The problem that I think we see in law enforcement is we see a lot of the same individuals over and over again. And that ranges from young people who have developmental disabilities to adults with mental illness to people that suffer from Alzheimer's and dementia. But the people that we tend to see over and over again are the people that don't have access. They're uninsured or underinsured. They don't have the same access to medical care. It tends to be the individuals that do have the proper medical care that we only have to interact with once or twice. And once we get them on track with the proper mental health resources, they get the care that they need, and they no longer become an issue for law enforcement. It's the individuals that we see time and time again that don't have access to proper medical care, and I think we need to do something about that, and it'll greatly improve, reduce law enforcement calls for service. If you look back, Virginia Tech, Sandy Hook, there were instances that mental illness was an aspect of that. And those individuals did not receive the proper, in a lot of cases, the proper care. It wasn't identified and communicated to law enforcement. And I think that's an important aspect. We, again, in law enforcement, we do a really good job on responding to those instances. But however, when it gets to that point, it's just that it's a response, and there's going to be a loss of life. So I think one of the things we need to do is work towards identifying people that have the potential for being violent, and I think the mental health system and getting people proper medical care is a big part of the prevention aspect of active shooter, active violent incidents.